perspective. So Eirini, could you please pass to the housekeeping slide? Thanks. So if you could all check your audio and visual settings before we begin, so your microphone and camera. If you can feel free to use the chat at any time. We've got a dedicated section at the end for any questions. If you would like to speak, please raise your hand and we'll be recording and tweeting about the event. There'll be a 35-minute presentation and a 15-minute Q&A. Thanks, Eirini.
So we're waiting a couple more minutes, right? Okay.
Yes, thanks. Just until 11:05. Okay, good morning, everyone, and welcome to our webinar. I'd like to introduce Dr. Eirini-Christina Saloniki. She is a Senior Research Fellow at the Department of Applied Health Research at UCL and the NIHR Arc North Thames, and she'll be presenting today on measuring disability, a secondary data lens perspective. Just in a few minutes, I'll paste some details in the chat about some other events that we've got coming up soon. So welcome, Eirini, and thank you. Can start now.
Thank you, T, and thanks everyone for joining us this morning. It's great to see so many of you with interest in this area. Sorry, let me find. Okay, so today's talk is going to be around three main areas. I will start with giving you a quick overview of the conceptual models of disability. I will then move on into talking about how we define or identify disability in quantitative surveys or studies. And finally, we will touch upon whether the choice of the disability definition has an impact on disability prevalence. So thanks to everyone who completed the Mentimeter. I got a gist of your background and what are your aims from this and hopes from this webinar. I'm hoping that we will cover most of the questions you had or expectations. Unfortunately, I won't be able to cover anything around quality of life. So this webinar is all about disability. However, if you have any questions, I would be very happy to be contacted later on after the webinar via email if you want to know something more specific around quality of life or any other questions in general that you might have and are not going to be covered at the end during the Q&A session. So the first topic we are going to discuss is about conceptual models of disability. So if you would like to put it simply, what a conceptual model is a term or a set of terms that can be used to explain a concept. In this particular case is the concept of disability. So in order to understand the concept of disability, we need to understand some key terms. Disability can be conceptualized in different ways. It can depend on the person who is actually experiencing or not experiencing disability, whether it's someone with prior knowledge around this topic, but more broadly speaking, there are four main concepts or terms that you need to understand in order to be able to conceptualize the concept of disability. Disability is not an easy term, it's very complex, and as you will see later on, it can be very tricky to define in quantitatively in survey data. So the terms that you need to understand are impairments, functional and activity limitations, and participation restrictions. Starting with impairment, impairment is known to be defined as the loss in bodily function resulting from a health condition. So it could be, for example, in the loss of an arm or a limb, whereas functional limitation deals more with difficulties that a person might have in different areas of function. So it could be things like difficulty with the ability to see or hear, or if you're paralyzed in some core areas of your body. On the other hand, activity limitation is a broader term than functional limitation, and it also incorporates other forms of activity in the environment. So these could be things like the ability to cycle, for example, drive, or using the public transport. And finally, participation restriction is the difficulty an individual is experiencing in getting involved in a life situation. So it could be, the situations could be, for example, the opportunity to be in employment, to be part of the civil society, or the opportunity to access different education opportunities. So impairment is often a prerequisite for disability. However, impairment does not automatically impose a restriction, either that is a functional, participation restriction, which is usually required to define disability. I put this quote here from Altman, who highlight that impairments do give rise to functional limitations and are likely to put someone at risk of activity limitations and participation restrictions. So, as I said, this is a quick overview of three important models. However, we acknowledge that there are several others that can be used to conceptualize the concept of disability. And I will start with the medical model, which some of you might have come across before. So in the medical model, really the individual, the person, is the focus of the attention, and their responsibility is inherently theirs. According to this model, disability is a result of a physical and mental restriction, and rehabilitation and clinical intervention play a very important role. One of the disadvantages of this model is that it does not take into account the influence of the society. However, the situation with the social model is slightly different. With this model, the focus is more on social barriers or attitudinal barriers, and the emphasis is more around promoting change, social change, either that is via improvements that are done in accessibility or any attitudes that individuals are facing towards inclusion. With this model, disability is something that the person experiences, and it ignores the impact of the impairment. The final approach I'm going to touch upon is the biopsychosocial approach, or biopsychosocial model, as you might have heard of. So with this approach, disability is not about describing the functioning of the person, but also placing it into its social context. So disability with the biopsychosocial approach is broadly defined. It collectively refers to impairments, activity limitations, and participation restrictions. You might have seen that the biopsychosocial approach forms the basis of the ICF, which stands for the International Classification of Functioning, Disability and Health. And it has been characterized as a systematic and comprehensive way of conceptualizing the population with disabilities. However, there are, of course, several other views that lie between the two extremes. By that, I mean the medical and the social model. Someone could say that the biopsychosocial approach combines, in a way, the medical and the social model. And there are, of course, other theoretical models, such as those who focus a lot more in the convention of the rights of persons with disabilities, for example, whereby disability is still related to the International Classification of Functioning, Disability and Health, but it is an evolving concept. This reference I've put here is a really detailed report that, if you are really interested in other theoretical models outside of the three core ones that I'm presenting here today, it's a very thorough report that you can have a look at. Just to say that all the references are available at the end, so you can look into them if you wish. So let's move on to the more nitty-gritty stuff, as I say. So this is more about how do we identify, how do we measure, how do we understand disability in quantitative surveys, in survey data. And is it really a maze whereby you're trying to find the exit, or is it a mess? Well, to me, it's a mess, and this is really because it's often the concept of disability, or how you identify disability in surveys, is depends highly on predetermined survey questions. However, those questions, and unfortunately for us, can vary over time, but also across surveys and across countries. So, as I said earlier, disability is not an easy concept. And in surveys, it can be a very complex one too. Okay, so I will start with some international references, and then I will provide a UK overview, because I think it's good if you have a more broader context in mind. So the first way to measure or understand disability in surveys comes from the international literature. It's called Washington Group Sort Set. So it is a functional approach that gives more emphasis on the functional capacity of the person who has the health condition rather than the health condition itself. So it was developed by the Washington Group. It is used in several countries and has been widely accepted. It is based more into the biopsychosocial approach, and is a fairly short set that can be used in censuses and national surveys. I have added a hyperlink here for you in case you would like to read more about this set. But just to give you an idea of how the questions look like, so it's a set of 6 questions, and it goes as follows. You get this little prompt at the start. The next questions ask about difficulties you may have doing certain activities because of a health problem. So one thing to note here is that these questions refer to your current situation. And then you're being asked the set of 6 questions. For example, do you have difficulty seeing even if wearing glasses? And the rest of the questions focus on other domains such as hearing, walking, or climbing steps, remembering or concentrating, self-care, such as washing all over or dressing, and any communication difficulties, for example, understanding or being understood. Now, each of those questions have 4 response options: no difficulty, some difficulty, a lot of difficulty, and cannot do at all. You may wonder, okay, yes, we have those questions. How do I identify somebody as being disabled based on their responses? You do so if the person has responded with a lot of difficulty or cannot do at all in at least one of the 6 questions. In that case, the person is considered to have a disability. And that's really all about this set. So as I mentioned, the set is used internationally in several countries. I've just picked up a couple of cases here for you to see. The first one is from New Zealand and the Canterbury Wellbeing Survey, and the other one is from Denmark and the Survey of Health Impairment and Living Conditions in Denmark. So the wording is, you can say, is fairly consistent with the original Washington Group sort set. Of course, there are some slight changes just to try and fit with the needs of the country and how people understand the different wording. So one thing to note here, for example, is that for New Zealand, you can see that the response options are slightly different. So you have no difficulty, yes, some difficulty, yes, a lot of difficulty, and cannot do at all. Whereas for Denmark, the response options are the same as in the original set. The reason I have highlighted the stat, so here I'm just showing you the last question, the last domain, which is about communicating. So difficulties with communicating, and the reason I have highlighted some of the words is just to show where the different wording comes. In the last couple of years, there has been a new initiative which some of you might have seen. It's called Disability Data Initiative, and is every year they produce a report. There is one available for 2022, whereby they review a set of disability questions in censuses and household surveys, and they provide not just estimates of disability prevalence, but also estimates, well-being estimates between women and also across different countries, 35 to be more precise. So I was curious to see what's the case with the UK. Are we listed? And if we are, how is disability be considered or defined according to this initiative? One thing to highlight is that with this initiative, they are more interested in questions that are closer to the Washington Group sort set. And as you can see from this screenshot, UK, yes, was one of the countries that was examined, but there were no questions that were close enough to the Washington Group definition. And I'm not very surprised about that because, for example, if you think of the census, the last one in 2021, the questions around disability were 2. So the first one was about, do you have any physical or mental health conditions or illnesses lasting or expected to last 12 months or more? You could say yes or no to that. And if you have responded yes to that, then you would be asked, do any of your health conditions or illnesses reduce your abilities to carry out day-to-day activities? And again, if you had responded yes to that, then you would be considered as disabled. If you have responded no to the first question, then normally you would not be asked the second question, and then you would be considered as non-disabled. Yes, but what's the situation with in the UK? How do we identify disability in UK surveys? So there is you can say, a fairly old report by one of my colleagues and other co-authors back in 2004, whereby they highlight that there are 3 established definitions, disability definitions. However, there are many others as well. I will just give you an overview of those 3 definitions, and then I will present a couple others that might be useful for you to for your study, for the aims of the study that you're interested in, and also they might be food for thought for where do we go about identifying disability in the future in a more harmonized or consistent way. I am aware that there was one point about someone wanted to know a lot more about harmonization of the disability questions, and I will touch upon that in a minute. So the first definition, we call it, or is well known as activity limiting disability. You might otherwise have seen it as a global binary indicator, and that is because it has been used widely in several quantitative studies, not just in the UK, but also in Europe. So according to this definition, there are 2 questions. The first one is, do you have any long-standing illness, disability, or infirmity? By long-standing, I mean anything that has troubled you over a period of time or is likely to affect you over a period of time. Typically, the response options to that question are yes or no. If you respond yes to this, then you are asked a second question: does this illness or disability, or do any of these illnesses or disabilities limit your activities in any way? One thing to highlight and for you to keep in mind is the time frame or the situation that these questions refer to. Here we have this reference in the first question about over a period of time. In some cases, this is further explained as in the last 12 months. In others, it is not. And that is also different from the Washington group sort set, whereby the situation refers to your current status with no specific time frame in the past. So in the second question, does this illness or disability limit your activities in any way? Now, there are 2 options here. In some surveys, you will find it as a yes, no. More recently, particularly after the Equality Act, the anti-discrimination legislation in the UK, you will find it as yes, a lot, yes, a little, or no, not at all. So if the person has responded with yes in the first question, and yes, a lot, or yes, a little, or just a yes, depending on the survey and how the response options are being provided, then the person is considered to be disabled. If they respond no to the first question, irrespective of whatever the second question is, I mean, the response is, typically you are not being provided the second question. You don't have the opportunity to respond to the second question if you have responded no to the first, but the restrictions have been relaxed recently, so you are being given both questions essentially, and then you go from there. So if you respond yes to the first and yes to the second, either that is just a plain yes, or yes a lot, or yes a little, then you're considered disabled. In any other scenario, you are considered non-disabled. The second definition is called work limiting disability. So here you've got 3 questions, but in some surveys, questions 2 and 3 are combined. So the first question is, do you have any health problems or disabilities that you expect will last for more than a year? You can see here the clear time frame. And the second and third question are more linked to any work limitations. Specifically, does this health problem affect the kind of paid work that you might do? And does this health problem affect the amount of paid work that you might do? Now, if you respond yes to the first question about any health problems or disabilities that will last for more than a year, then again, you're being asked the follow-up questions. And if you say yes, as in your health problem limits the kind and amount of paid work, then you are treated as work limited disabled. In any other scenario, you are treated as, if you say no to the first question, then you are being treated as non-disabled. If you say yes to the first question, but no to the limitation in terms of the kind and amount of paid work, then you are treated as non-work limited disabled. And the last definition is about legislation-related disability. An example is the Disability Discrimination Act that most of you are aware of, or even the Equality Act, more recently in the UK. According to this definition, again, you have 2 questions. Do you have a physical? The first one is, do you have a physical or mental health condition or illness that has lasted or is expected to last 12 months or more? And you can say, you can respond with yes or no to this one. If you say yes, then you are being asked the second question. Does this condition and or illness reduces your ability to carry out day-to-day activities? And again, here it can be just a yes, no, or more frequently you will see it as yes, a lot, yes, a little, or no. So if you respond yes to the first question and yes, or yes, a lot, or yes, a little, then you are considered to be disabled. If you respond no to the first question, then you are considered as non-disabled, and any other combination. So yes to the first and no to the second, then again, you are considered as non-disabled. So the activity limitation definition does align closely with the legislation definition. However, one thing to highlight is that you will see that in the legislation specific one, there is a reference to day-to-day activities, whereas in the activity limiting disability definition, you get just general activities. There's no specification around day-to-day, which means that you cannot conceptualize, you cannot distinguish between the different types of limitations. There was a recent, now the question is probably, so which one do I use? Given that there are so many, is a mess. There was a recent report, briefing, if you want, from the House of Commons. And in that report, they used a definition that is very close to the legislation related one. And they also call it as a harmonized disability definition. However, the paradox here is that in some studies, you will also see the activity limiting disability called harmonized disability definition. So if you would like to read more about this briefing, then I have included the hyperlink for you, and it is quite detailed and is from 2022. So it will give you an indication not just about how disability is being defined, but also of prevalence in the last year. However, there can be other questions that you'll find in the survey, and then what do you do about it? Are you still able to utilize them? And if so, how? So I picked up a couple, one that I have come across. One of them is, are you or are they registered as a disabled person? Which is a more direct question, of course, with a local council or social services, and is just a yes or no response. And then there is another one around, do you think yourself as disabled, or do you consider yourself disabled? Again, both of those are very direct questions. And of course, which I've not included here, there are more specific questions about disability benefits. So especially in household surveys, you will get a section around benefits, and you'll be asked as to whether you receive certain disability benefits. So somebody can argue that I can also identify somebody as being disabled from responding positively to those questions. Yes, that's true. So it's a matter of thinking about the aims and the content of your study in order to decide. You might want to go with a more frequently used measure, or you might want to be more closely aligned with the legislation definition, or you might be interested more in especially if you're dealing, for example, with administrative data and you are more confident about responses around receipt of disability benefits, you think that the question around disability benefits is more accurate. So I wouldn't say that there is a gold standard at this point, although there are several attempts in the last few years to try and harmonize the questions and have more consistent wording across the different surveys, particularly in the UK. I think we are aiming towards that, but there is still quite a way to go. In the meantime, you know, in the surveys, you will see, as I said, a variety of questions, and it really depends on the content, the aims, the scope of your study in order to decide which definition to use. But it is likely that in most surveys, you will come across either the activity limiting disability or the legislation related one. So the more direct ones are more rarely found. They're still there. That's why I thought I mentioned these to you, but not as frequent. So I just wanted to give you a quick overview of a project that currently I'm working with a colleague of mine, William Lemons, within the ARC North Thames. And given this variety of questions in UK surveys, we wanted to try and collect all of those questions, or identify all of those questions in all possible UK surveys from 2010 onwards, so after the implementation of the Equality Act. And also because we think that that's will help us understand better the complex and often misinterpreted concept of disability, but it will also help boost the use of disability or disability-related questions and any insights they offer in relation to the specific conceptual models of disability. So this project is currently live, and how we're going to do it, we're just going to review large database of UK surveys so that we can identify all the disability and disability related questions. And then we are going to collaborate with disabled people, members of the public who do have that lived experience of disability, so that we understand how those questions we have identified can be used and how best to share those findings. And I'm moving on to the last part of this talk, which is about the definition and the choice of it. Does it matter, and does it impact on disability prevalence? The short answer is yes, it matters. But it really depends on who is interested in the concept, how is disability being defined, and then of course how these two aspects impact on subsequently on prevalence. So recently I looked in the last 10 years, but of course there might be literature even before that. I was more interested in any evidence after the Equality Act in the UK, and I found that there is emerging literature in looking into this, so how the different disability definitions impact prevalence. I have just I'm showing you 4 papers that I found here, but they are all dealing with this issue. And they are quite international papers, so a couple of from the US, one from Denmark and another one from Australia. I did not identify anyone from the UK, but there might be something and I've missed, hopefully not. So in terms of the US papers, they focus on the comparison between the Washington Group sort set and the American Community Survey 6. So the Washington Group sort set, we already talked about it. The American Community Survey covers the same 6 domains as the Washington Group sort set, but the wording of the questions is a bit different. So just to give you an indication, for example, one question is, are you blind or do you have serious difficulty seeing even when wearing glasses? So this is a bit difficult to the Washington Group one, which, if I recall correctly, is do you have a difficulty in, etc. And so in the Danish paper, they compared the Washington Group sort set definition with a global activity limitation indicator. So what this is for at least the past 6 months, to what extent have you been limited because of a health problem in activities people usually do? Would you say you have been severely limited, but not severely or not limited at all? So this is not too far from our activity limitation definition, or the global definition, as I said earlier, but notice the different time frame. So here they talk about the past 6 months, whereas in our case, it was more about the last 12 months. And in the Australian paper, they compared the Washington Group sort set with the binary disability question, and that is, do you have a health condition or disability that has lasted or is expected to last 6 months or more? And does that restrict your everyday activities? And people can respond with yes, no, or prefer not to say. So I suppose you're more interested into what do they find and what does that mean essentially. So I just picked a couple of them because I think they were more interesting. So in the Danish paper, they did find whereby they combined the Washington Group sort set with a global activity limitation indicator. They found that with the Washington Group sort set, they had twice as large disability prevalence estimates. And when they looked at the 2 estimates, the Washington Group and the global activity limiting indicator, and they checked the overlap, they found that less than a fifth responded with a yes to either indicators. So they concluded that the global activity limiting indication does potentially capture a more restrictive version. There is also the issue with the Washington Group that does not consider the duration of the health problem, and it does not explicitly also include any mental health questions. They also checked any demographic differences between those who responded to the first and the second measure, and they only identified small demographic differences, but there were substantial differences in health profiles. So it does look like there is an impact in health profiles depending on the definition. In the Australian paper, in that case, they compared, just to remind you, the Washington group sort set and the binary disability indicator. Again, they found twice as large prevalence estimates with the Washington group indicator, which someone could argue that goes back to the points around the duration of the problem and inability of that set to capture any mental health questions, and the fact that the Washington group set is really likely to capture function disability a lot more. But on top of the issues with the questions, the wording across the different countries, there are other things that can also influence disability prevalence. And these are linked more with the methodological side of things. So things around data processing, for example, how do you account for missing data? Or how do you weight your data to try and to make it a representative sample? It can be linked also to context effects or priming. So that means any questions that come before or after the disability-related questions might influence how the participants respond to the specific disability questions. And finally, sampling. So it could be issues with non-response, people not responding in follow-up waves, or it could be also sampling error. So it's not just about the definitions per se, but it's also about other data collection methods that are more linked around how the survey is being designed and later on being responded by the participant. So some concluding remarks from me, and really this is the end of what I wanted to tell you about this topic. This is really an overview. We can talk for quite a long time about it, but I just wanted to give you a flavor and also keep you up to date with more recent literature. As we said, there are several conceptual models that exist. We touched upon the medical model and the social model, and also talked about the biopsychosocial approach with some other theoretical approaches also being in existence. It is not easy to identify disability in survey data. We as quantitative researchers often find it a challenge, and we have to triple think about what is the study about, how do we want to do it, also have at the back of our mind the legislation, and then it's a matter of, do we follow the gold standard? Is it really gold standard? I would say no. Or do we go with the most common measure? And this is what we end up most of the times doing. So we either use that activity limitation definition, or we use the more legislation related affiliated definition. One thing I would like to say, and I should have said it perhaps earlier, is that in that older study in 2004, there was a comparison of disability prevalence estimates between the two definitions, so the activity limiting disability and the legislation related one, and there was a fair bit of overlap between the two, but still you will find surveys that have either or of those two. And the choice of disability measure does make a difference, not just in terms of the prevalence, the disability prevalence, but also potentially in terms of socio-demographic characteristics, and importantly, in terms of health profiles and perhaps employment or other outcomes. So it should not be ignored. But of course, there are other factors that can impact prevalence and all other outcomes or characteristics. And these could relate a lot more with how the survey is being designed and how the data is being processed later on. So things around how missing data is being handled, any before or after questions that come that are being chosen just before the disability questions, and also any sampling issues. So whether you're able to follow up people over time, if you have sample errors and so on. So that's all from me, and I'll be very happy to take any questions you might have after this.
Thanks so much, Eirini. Thank you. We will have some help from Harpreet and Greg for the questions. If you could post any questions in the chat, and I'm just going to press send on some details about some future events that we've got going on as well. Thanks so much, Eirini, again for a lovely presentation.
Waiting for the first questions to come in, Eirini. So just a quick question I had for you is how would you go about kind of accessing that survey data that's collected on, say, a government survey?
So they are normally using surveys that are available for secondary use. So one example is the Family Resources Survey or the Labour Force Survey. And both you can access them via the UK Data Service. So as researchers, for example, myself as an academic, you can easily create an account, it's for free, via the UK Data Service. And then you can access, of course, you will access the data at the regional level. If you want to go down, for example, to a local authority level or a lower geographical level, then you will need to apply for special license, and it takes a bit longer. But for the regional data, you can access it for free, of course, if you have this user, we call it end of user license account, but it's very easy to create via your organization. I know that with academia, that is very straightforward. I suspect with NHS colleagues should also be feasible to do as well.
Great, thank you. It's good to know that you can set up your own accounts to access some of it.
Eirini, we have a question from Fiona. I think her hand's up if you want to ask your question, Fiona.
Yeah, hi. Thanks, Eirini. That was really interesting. I just wondered if you could tell me, because I don't know about these measurement scales particularly, particularly the Washington one, which you said is often seen as a gold standard, although you've shown that it possibly isn't. How do conditions that are maybe intermittent, like relapsing, remitting MS, for example, how do they get picked up in these, or is it just considered, well, it's covering such a large sample size, it doesn't matter and it'll all be balanced out?
So two things, thank you for that question. Two things, I suppose. One thing to mention is that the Washington Group sort set is not widely used in the UK. So you'll find it particularly in the US and other non-UK countries. And your point about, for example, relapsing MS, I suspect you could focus on certain items within the 6-item set and see how, if you are observing those participants over time, you can see how the responses change over time, and that can give you an indication of relapsing. If you don't have the Washington Group sort set, then I'm aware that, for example, in Understanding Society, which is another large UK household survey, There is in at least one of the two questions that refer to the activity limitation question. Again, the wording is slightly different to what I presented. Unfortunately, this is the nature of the data, but they provide a list of different health conditions. So again, you might be able to pick up kind of the one that is closest to any issues, for example, mobility issues that a person might have, which could directly link to MS. And then again, see how that fluctuates over time if you're observing the same person over a number of years.
Thanks. Yeah, I think it was more the fact that it's how you're feeling today, kind of your current condition, and what does that mean for people who have conditions that are changing on a regular basis. So whether in a lot of the UK surveys, timescales are used, aren't they?
Yes.
So
yes.
that's what I was. Yeah.
We ask about over the past 12 months or for a period of 12 months. So of course, you know, if you have something that it changes in a shorter period than 12 months, I think you are unlikely to be able to capture. I would think, yes,
Yeah,
at least from those kind of secondary survey data.
Yeah,
So,
thanks, Eirini.
no worries.
We have another question in the chat, Eirini, which is, what is the WHO advice recommendations on what to use?
Yes, I was expecting that question. So that one is, they are more aligned with the ICF concept or the biopsychosocial approach. So they are more likely to link up with the Washington group sort set with all the caveats that this set comes with. So short answer is the Washington group sort set and the biopsychosocial approach in terms of conceptual model.
Thank you.
Fiona, you've got your hand up again.
Sorry, yeah, if there's no other questions, I'm happy to ask. So I just wondered, you said at one point about how sometimes eligibility or receipt of disability allowances can be an indicator of disability. I wonder what your thoughts are about the political context about that, because obviously that changes, eligibility changes depending on political will, etc.
Yes, I mean, it really depends. So if you're working, for example, with surveys like the Labour Force Survey or Understanding Society or Family Resources Survey, then these questions should adapt to any changes, at least in terms of the wording. And that makes our life, researchers' life, more difficult because the wording changes and you can not track accurately people over time. I suppose the other challenge with those questions is that although they are framed in a way to capture, you know, changes in like political changes or other more fundamental changes, people are more reluctant to respond truthfully to those questions for several reasons. So it might be they are worried, you know, they might take their benefits away from them. They might be worried of social exclusion or discrimination that they face, although truly speaking, that's not possible if you present the data in an anonymized way. If you move on to administrative data, where you would think, you know, they're more accurate and there are more ways to track what is actually going on, it's quite hard to, I suppose you have to have two things on the side. So being aware of the different political climates over the years, and also how that is going to impact your responses, because it should impact in some way. How can you go about it quantitatively when you want to examine those changes or potentially cover another topic in this area? I suppose you have to either use, well, I'll mention something here, some kind of a difference in difference methodology, whereby you account for the before and after. So what was the case before that change happened and what happens after it? Or you have to do some, I don't know, something more sophisticated, potentially methodologically, to be able to capture some of that. But it's quite hard to try and pin it down, especially if you're not working with administrative data, I would say.
Thanks, Eirini.
Thanks. We had just one last question in the chat from Jordan, and then I'll wrap up.
So that last question is, how might someone go about identifying someone with a permanent / lifelong disability since birth? It might be important to identify this group to understand the effects of being disabled for a much longer period of time.
Yes. I suppose, unfortunately, you're not given that option within the wording of the existing questions, because they either have, let's say, the last 6 months or the last 12 months time frame. I'm trying to think, there might be some more specific health condition questions that can help you unpick that. Or if there are some cohort studies that follow individuals from birth till, later in life, and you might be able again to capture any disabilities like that. Obviously, that is a fairly rare phenomenon, but I would say not from the kind of the broader questions that exist around activity limitations or, limitations with work. You wouldn't be able to capture something at birth unless you focus on specific health conditions, questions that are included in the survey. Sorry, it's not the greatest response, but I would say the question is not possible.
Thank you, Eirini.
The current wording.
Thank you, Eirini. Laura's got a last question, but as we're running out of time, would it be possible to follow up afterwards?
Yes, that's totally fine with me. Thank you.
Thanks so much, Eirini, for a beautiful presentation and a really interesting talk. And thanks everyone for coming, and we'd be really grateful if you could fill out the feedback form. Thank you.
Thank you for that. Thank you.